He's not a student, by the way.
It's okay, you're still welcome.
He works with me, so.
Okay, so now this is a little bit about scholarships. So I'm not quite sure where you are in your education. This may be something that you could be interested in. But basically, we're looking, it's more competitive than loan repayment, although loan repayment is also a competitive, but it's more at the site level and at their scoring, for their HPSA scoring. The higher the score, the greater the need. But for scholarship, it really is at the individual level. Again, they're looking to award about 230 scholarships. And basically, you'll have to have a minimum of 2 years service obligation. But for every year of support, financial support that you receive, you would pay back in service. But there is a minimum 2-year service commitment. Now, with scholars, based on your discipline, so for a PA, a physician assistant, you would serve at a site that has a HPSA score of a 15 or higher, and for all the other disciplines that were on that list. And we'll make sure that you get a copy of the presentation just as a reference. But then you would need to work at a site that has a HPSA score of 17 or higher. So, and here on the Hawaiian Islands, we do have 3 that have higher HPSA scores. So we have in Oahu, we have the North Shore area has a higher HPSA. On the Big Island in Hilo, we have higher HPSA, and in Maui. So just to give you a sense of the need that exists here. There are other sites, other community health centers and private practice sites that also meet the needs of the underserved. They just don't have as high a score. But for scholarship, that is a requirement. They go to the area of greatest need. Oh, let me just tell you, and as of a week and a half ago, we have a very new thing that's exciting for sites, is that traditionally there was a limitation to having 1 scholar work at a high HPSA site. And now the National Health Service Corps, based on feedback and suggestions that they've received, they modified it. Now they're making an exception on a case-by-case basis. A site can apply to have more than 1 scholar per discipline work at their site. So this is new, and it's exciting for the program and exciting for the community. So where in times past, if a scholar wanted to work at a site and there was already a scholar there, it was not available to them. So that's a little good news. And so this is a little leaner than the loan repayment list, but this is the list of disciplines that are available for scholarships. Okay. And as I said before, it is a more competitive program, but it does pay for all your fees, all your tuition, your books, your instruments. There is a taxable living stipend, but everything else, it's basically a full ride scholarship, which in some cases, it could be more than what you'd receive in loan repayment, when you do the math and figure out what it costs to go to medical school. So we're excited about being able to offer that. And I think, as I mentioned earlier, so probably got ahead of myself. I'm just so excited about this. So again, this is for the HPSA scoring. And this, you know what, this got, I think I sent this before I found out that was official. So this was very new, hot off the press. So I apologize. I'll make that correction before we send it out. This is another opportunity. We have National Health Service Corps ambassadors. And if I may, we have Senator Green here, who is also a scholar, former scholar, and ambassador for our program. Dr. Kelly Withy is also an ambassador for our program. And so these are individuals such as yourselves. If this is a program that you plan to participate, we welcome as many people who are enthusiastic about providing service, public health, and promoting our program and telling people about their own experience, the good, the bad, the ugly. Not every experience is great. What I was saying is, yesterday I was meeting with a group of family practice physicians and the residents, and I said there are things that you will never learn in a classroom. It's on the ground experience working in the community health center setting, or in the community practicing medicine, and but it's exciting. and it's rewarding. And beyond what scholarship and what beyond loan repayment can give you, you are getting the satisfaction to know you're making a difference, and that's your take-home pay. So anyway, again, it's a dedicated group of volunteers. You may know some already on the campus, other than Dr. Withy, who is telling you about the program. And again, you can have access to all the materials and all the literature that you need, so that as you go around and you want to promote the program, you can continue to make more people aware about National Health Service Corps. It has been around since 1970. We're trying to kind of rebrand and promote and improve the image of National Health Service Corps, because we just don't think enough people know about that we exist. But we are trying to actually get the name recognition to that of kind of like Peace Corps. So when you hear Peace Corps, a picture comes to mind, and that's similarly what we're trying to create, that when people know, oh, you're a National Health Service Corps provider, you're working in these underserved communities, thank you. You know, that's kind of what we're going for.
Can you tell us again how many people are in the National Health Corps now? How many providers?
We're a little over, close to 8,000, and we're projecting by the end of fiscal year 2011 that we'll be about 10,500. So it's growing.
And how many physicians total of the 10,000? Of the 8,000, sorry.
I want to say over 5,000. Yeah. So we're excited.
How
Yes.
many are applying?
I don't have the exact number, but I can get that to you. So, let's see here. Oh, we talked about it. You know, they're blending their passion for the program and for their personal, experience. Again, promoting it, recruiting, retaining our providers. It's just a wonderful opportunity also for you to connect with other people, to learn from them. Mentoring opportunities and advocacy, for the people that you're serving. And advocacy for the program and for others that are serving. So we're just excited. So that's another opportunity that's available for you. And right now, we have about 1,300. I would say people kind of come and go. So some people join and some people fall away. So it may not be an exact number, but we are looking for people from all disciplines to represent. And you'll never know, because this information is on the website. And so anybody has access to this, and they can look up by their state, and they might see your name and say, could you come and talk to our students at our medical school, or could you come talk at a conference? And so you do what I'm doing. So it's fun. So this is a little bit more, this link is also available directly on the website. There is a section for ambassadors. Just want to make you aware that another recruitment site that is popular is 3RNet for a rural recruitment and retention network. There is one here for the state of Hawaii. They post all the vacancies. All the information is very readily accessible for all the islands, and it's just a good source for you as you are searching for potential sites. I would encourage you to visit that website. And this is what it looks like. And all of these are hyperlinks, so if you click on the island or you click on the name, either one will work for you. But these are all kind of tools for you. And then here's more resources for our website. Again, Facebook, YouTube, Nursing Scholarship Program, Nursing Education Loan Repayment Program. There is YouTube. I was going to ask you, do you know who the name of our Surgeon General is? Dr. Regina Benjamin. And she actually was a former scholar. She worked in a shrimp boating community. She went door to door with her pickup truck providing services to people living in mobile homes and dealing with people off the shrimp boats and their injuries and things of that and their families. And she was handpicked, and she is now our Surgeon General. So I just want to let you know that is the kind of impact you can make in your community, and it's recognized. So I'd encourage you to check out even YouTube just to learn a little bit more. There's other providers' experiences that they're happy to share, and there's so many. I mean, there's more stories to tell about the impact that people such as yourself going into medicine are having. So I would just encourage you to consider this as one way of not just paying for your loans, but giving you a sense of direction of where you might consider practicing your medicine. So thank you.